Hello, everyone. This is Haley Hansen. I'm the leader of Husch Blackwell's Higher Education Group. We're excited to be talking with you today about return to sport from COVID-19. Before we begin, I'd like to cover a few housekeeping items. At the bottom of your audience console are multiple application icons for your use during the program today. I'd like to take a minute to just highlight a few of the icons for you. If you have questions during the webinar, please submit your questions via the question box. We will try to answer all the questions during the webinar, but we have quite a few folks on the call today, and we may not be able to get to all of your questions if we run over. We truly appreciate audience participation and do encourage you to submit questions. There's also an icon to assist you with your viewing preferences. Accordingly, please note that you can expand your slide area by clicking on the maximize icon on the top right of your slide area or by dragging the bottom right corner of your slide area. If you have technical difficulties today, please click on the help icon. It has a question mark and provides information regarding common technical issues. A copy of today's slide deck, along with actually many helpful materials, including a checklist put together by USCA and a framework for return to sport, are all located in your resource list icon that looks like a folder at the bottom of your screen. So you want to make sure today that you check that resource list icon and that you download and print the slides and materials that have been provided by USCA today. This program has been approved for Illinois, Iowa, Nebraska, and Tennessee continuing legal education credit. Missouri, Texas, and Wisconsin are still pending. To report your hours in Illinois, Nebraska, Tennessee, or Texas, please click on the CLE icon at the bottom of your screen and complete the questions. You may download the certificate of attendance from the certificate icon at the end of the program today. A recording of this webinar will also be available for you tomorrow for watching and sharing. Once available, a link to the recording will be emailed to you. The recording link will be open and available for sharing at your institution for 2 weeks. Joining me today is Dr. Jim Borchers, co-founder of the U.S. Council for Athletes' Health. He is a leading expert in student and athlete healthcare and has over 15 years' experience in both leading and consulting with organizations in all aspects of student-athlete healthcare and safety. We are so excited to have Dr. Borchers with us today and talking about this important topic. So with that, Dr. Borchers, I'm going to turn it over to you to get us started.
Haley, thanks so much, and thanks to all of you that are joining us here today to talk about this very timely and very important topic as we return to sport from COVID. With our work at the U.S. Council for Athletes' Health, we've been working with our partners and those seeking guidance and answers on how do we return to sport during this time of a pandemic. I think just by way of introduction, as you can see here on the first slide, the return to sport is really going to be guided by answers to 3 questions that we need to address as we think through this presentation and as we prepare for the return of students and staff to our campuses. The most important question is, how are we going to slow the spread of the virus? That really is going to be integrated into all of the recommendations that you're going to see here today and all of the discussion items. That's going to be unique to everyone's campus and to their resources and situation, but needs to be one of the questions that's at the forefront of what we're thinking about. The second is, how are we going to ensure that we have a safe home environment, safe environment for practice, and a safe campus? And then the third question is how soon can we safely resume sport participation? And I think we're all aware of what's been going on here recently with the return of many sports, including professional and collegiate sports and training, and what has happened with this virus and spread. And so to answer these questions, we need to continually evolve our thinking, not only just day to day, but certainly week to week. And our team is monitoring these changes, and we hope to provide you today with very current information that's really going to help you when you think about your eventual return to sport. For the sake of today's discussion, we've separated our discussion into 6 different categories that you can see here: development of policies and programming, personal education and training, facility and management, return to campus recommendations, training and practice modifications, and then sustaining cultural change. And as Haley mentioned, we provided resources for you today that include a checklist and other recommendations that you'll be able to refer back to, including this slide deck. Let's get right into category 1, which is the development of policies and programming. Probably most unique to what's gone on with COVID-19 and return to campus and return to sport participation is the development of policy and programming protocols that need to be established. The first thing that needs to happen that many of you have probably done on your campus is identifying the individuals that are going to assist with the development of policies and programming protocols. Many folks have incorporated this into their return to campus, and this is really the development of what we call an action team or an athletics COVID-19 action team. These individuals have a lot of responsibilities, and some of them are listed here. First and foremost, we're recommending that you connect and adhere to local, state, federal, and even international guidelines if they pertain to your institution, because it's going to be really important that you're following what your local departments of health, state departments of health, and then certainly what federal CDC and other international guidelines state. One thing we know for certain is that this virus it is different in different locales, and certainly paying attention to the penetrance of the virus in your area is going to be important as you think about return to sport activities. This COVID action team also needs to collaborate with risk management and legal staff regarding obligations for testing, monitoring, symptom reporting, quarantine, and isolation, and you're going to hear that throughout this talk today with myself and Haley. We want to make certain that we partner with experts to create institution-specific requirements, review and incorporate the best practices provided by our governing bodies, and maybe most importantly is to identify a chief infection officer. This is the decision maker for the return to work or sport. And it's really important on each of your campuses to understand who the person is that's making the decisions on whether we're going to return to sport or not, pending the issues with this virus. We certainly want to have appropriate policies and procedures for safety. So for healthcare personnel, social distancing, testing procedures, contact tracing, quarantine and isolation, and then again, the return to work or sport criteria. One of the things that we know with this is that oftentimes the athletic training room, which has been an area throughout sports and certainly in collegiate sports, an area where athletes have gathered, is going to change. And healthcare professionals there, especially our athletic trainers, are going to have to adopt practices that really limit exposure to viruses. It's really important that we use face masks and other PPE during this time. We establish procedures for access to modalities, and we especially think that hot tubs, cold tubs, whirlpools, those things which will require strict hygiene and appropriate disinfection have to be evaluated. We also have to make certain that we have the right number of healthcare providers to athletes in each facility, and that our athletes, when they come into the facility, are determining how we're going to deliver health care. And most of the time that's going to be by appointment only, and processes in place for those healthcare providers to treat athletes that may have illness. And so the establishment by some institutions with virtual health and telehealth in order to make certain that those athletes that are sick or staff members that are sick are not coming to the facility as they might have in the past. We're certainly going to need protocols for general measures around social and physical distancing policies and determining procedures to maintain social distancing and educating all of our personnel, athletes, and staff on these new standards. There's no question that behavioral change is what's going to reduce infection rate, and with all the testing opportunities out there and other things that you're hearing about, it's behavioral modification that's going to affect what happens with our athletes. Certainly, we need to consider these policies for social distancing in the locker room, the training and competition facilities, our medical facilities, as we mentioned, and even the dormitories and other living facilities. But certain the magic numbers out there are 6 to 10 feet of distance when possible between individuals in order for social distancing to try to prevent viral spread, and certainly that is oftentimes with wearing face masks. But a couple other numbers just to think about is maintaining 39 square feet around each individual when they're training in a training facility or being in an athletic training room. And if you're unmasked and training, certainly trying to maintain twice that, or about 78 square feet around an individual to try to be at a safe distance. Certainly personal and group hygiene around hand washing and then proper coughing and sneezing techniques is going to be important as well. Certainly testing has been a big topic in the media, and certainly monitoring protocols. But we have to consider what's practical for the institution and what's going on your campus. So it's really important to consider the following. What types of testing are you going to do? And there's obviously different methods for identifying the virus, from some more invasive testing like a nasopharyngeal swab to less invasive testing, and certainly understanding the sensitivity and specificity around things like saliva testing, testing of just the oral pharynx, the back of the throat, or the anterior nose is going to be important. Frequency of testing has certainly got a lot of attention in the media recently, and even just this past weekend in the Washington Post, more discussion around the frequency of testing needed from epidemiology and infection experts for sport, and certainly something that needs to be considered on each campus. What populations are we going to test? And I think many of you may be going through the exercise of identifying essential staff who are going to work with the student athletes and tiering that staff appropriately to make certain that we're monitoring who has contact with athletes during high exposure time. And then certainly the costs associated with testing and monitoring is going to be really important. And certainly, especially with testing, it's been estimated that even just for one Division I football team in the NCAA, it might cost upwards of $500,000 for a season to test appropriately. Certainly, we have to review those policies to ensure they remain current, and then establish a system where we can monitor risk potential or contacts, our symptoms on a daily basis, our temperature on a daily basis, and again, exposure. One of the most important things on your campuses will be to define a contact tracing plan to identify a process for identifying others that may have been exposed to an individual that tests positive, and certainly what happens then with those individuals, how they're tested and monitored, and what you're going to do with those individuals. Certainly we want to have criteria around quarantine and isolation protocols, and should an individual test positive, what's the time frame for isolation, which is standard now at 14 days, but many are looking at ways to try to isolate for a lesser period of time depending on fever and symptoms, and certainly retesting more frequently. So it's going to be important that you define that for your institution. Identifying here the return to work, but certainly the return to sport criteria and plan, and that there's a consistent criteria for individuals or teams to return to activity, including things around acclimatization and transition periods, which are required after you've had a time of inactivity. So here is just from category 1, and I won't spend time here, but many things in this checklist here for you that need to be considered initially as we think about policies and procedures and protocols. And with that, I'll turn it over to Haley just for a minute here to have some discussion around some of the legal issues around this category.
Sure. Thanks, Dr. Borchers. First, and I think while I'm taking over a couple of slides, there was a little bit of your audio that's broken, so we'll try to fix that as well. But thank you for those who have let us know about that regarding being able to hear Dr. Borchers. One of the main issues that we get in terms of legal considerations, and I think something that you really need to be aware of that Dr. Borchers said is these decisions need to be made in consultation with a team and a group. And one of the decisions that a lot of return to sports questions have come from is whether or not we should create assumption of the risk or even waiver documents as our student athletes are coming back to campus. And so I've done in the next couple of slides just outlined what we see generally as these assumption of the risk forms. And, you know, some institutions are going beyond that and actually requiring student waivers. You need to make sure you're working with your legal department about that, or your outside counsel, whoever you turn to for legal advice, because those can be very tricky and can have state-by-state implications. So we're really not even going to talk about waivers today, but talk more generally about assumption of the risk. So you need to educate the student athletes of the known and unknown risks associated with returning to campus and returning to sport, and including that extreme sickness, all of the symptoms that Dr. Borchers was talking about needs to be explained within that document. You also should provide express notice that they may contract COVID-19 even if the institution does its best to follow CDC and other public health recommendations, that the risk simply cannot be eliminated, and that they understand that risk cannot be eliminated. Also, to make sure that the policies and protocols are followed related to athletics. So what are going to be your reporting protocols? And if you've had exposure, all of those details need to be laid out in this assumption of the risk form. That they've agreed to possible quarantining if they do have some of these symptoms or even test positive. The agreement and consent to testing and monitoring protocols for those student athletes. And then again, as Dr. Borchers was talking about, and we're going to go to in some detail in one of the next categories, we also want to talk about procedures for entering facilities, use of equipment, and locker rooms. So those are all things that you want to include if you're thinking about putting together the assumption of the risk form for your athletes to sign. I also think it's important for you to go beyond, kind of the notifications and actually lay out the expectations for beyond athletic facilities. So, what are you going to do about housing and occupancy and sharing of bathrooms or common spaces? What are going to be the expectations for those student athletes? Right now, you probably are looking at campuses that have been closed, and so as the student athletes are coming back, there's not very many students there, so it's more controllable. In the next few months, that's going to change for all of our institutions that intend on coming back to campus, and so we've got to look at that. Food service operations and availability and protocols for assessing food service, and as Dr. Borcher said, really look at social distancing expectations. And one of the main things that I think is going to be important to think about from a legal side is travel. Are you going to allow student athletes to travel back home? What are the protocols if they do travel? What if they, are they going to be, what if they are going out or going to a party or doing something with other 18 to 22-year-olds and could be exposed? Are those things going to be something that you want reported so that you know if there's an increased risk with any student athlete? So I'd make those determinations carefully, because I think you're going to have some risk or some question as to, why you're able to control or not allow a student athlete to travel home during the summer voluntary training, and what provides that authority to be able to do that, and are you going to treat students when they come back in the same manner, other students, which is likely the answer will be no. So think about all of those things. The one kind of bright spot before I turn it back over to Dr. Borchers that they do want people to be aware of is that we are seeing a lot of action during special sessions of state legislatures. I know in Kansas there's legislation that's pending, and many other states talking about indemnification for schools who return from COVID-19 and are following the CDC and other public health official recommendations in their area. And that if you're doing those things and you're following those guidelines and following that there would be indemnification for types of lawsuits. And I know that we've seen a couple across the country of lawsuits that have been specific of, I was put into a clinical setting and was exposed to COVID-19 and became sick. We've seen many more lawsuits, well over 100 now, of class action litigation against institutions for a variety of breach of contract theories for closing campus due to COVID-19 in the spring semester. So we're seeing that on really that push on a local or statewide level at many states. And then we also understand that the next version of the CARES Act, it's currently being referred to as the HEROES Act, does have some at least draft legislation. Who knows what will actually be in the final legislation, but that would provide some indemnification as well from lawsuits as you're returning to sport or returning to campus. So with those legal considerations, Dr. Borchers, I will turn it back over to you to start on our second category regarding personnel, education, and training.
Thank you, Haley. Sorry for any audio issues. Hopefully everyone can hear me here. Those are great points that lead us well into the next category, which is personnel, education, and training. I think that we all know that if you have policy, protocols, and programming, and those stakeholders or constituents that those apply to, we have to be able to educate and disseminate that, and it must be provided to all of our athletes, coaches, and staff prior to or upon their return to campus. We know that healthcare professionals and department staff need to ensure that the education process is ongoing to meet the evolving and current requirements and best practice for the control of COVID-19. And so having a process to do that is going to be really important. Certainly developing education modules for policy transparency and delivery we think is very important. The ability to do that to your constituents, including extending beyond your immediate university community to parents and others can be extremely important. We need training and education around the areas we've talked about, PPE, hygiene, the social distancing things that both Haley and myself mentioned, symptom monitoring and what the responsibilities are, and what is appropriate reporting. And I think appropriate reporting is the responsibility of the individual to report appropriately when they're symptomatic or when they may have had a potential exposure in order to mitigate risk of exposure to others. And so it'll be important for everyone to understand that and what happens when that reporting occurs. And certainly we want to make certain, as Haley mentioned, that we're not only meeting the institution requirements, but our state and federal local, state, and federal requirements as well. Some fundamental components to consider for education around this area is that we want the education to be relevant to specific groups you're delivering it to. And so certainly education for athletes might look a little different than education to coaches or parents or certainly to administrators, but that education should be applied consistently to all of your groups and making certain that the plan for education and why it's being done is transparent. Certainly we recommend that there's an assessment following the education to document compliance with the education, and even an attestation following the education that the learner understands that they're responsible for the material, that they can refer back to the material, and have the opportunity to ask questions if they arise and how they would be directed to ask those questions. I mentioned that education must be relevant to specific groups, and we encourage everyone to think about how they want to deliver that education to their healthcare professionals, student athletes, coaches, and staff. Certainly, thinking about an education committee can help with consistency of that education delivery, and an electronic learning platform to deliver the content can be extremely valuable and efficient in delivering this sort of education. We do recommend that we try to be as transparent as possible with your education, so putting your education programming on your institution website, and certainly distributing it to your staff and institution leadership so that everyone understands what's being distributed, and certainly doing that in consultation with legal and risk management staff is recommended. Certainly, I mentioned we want assessment following the education, so if you're using an electronic learning platform, having the assessment capabilities for content mastery, and then certainly having ease of use, so having that education available in today's world via either a smartphone or a tablet or laptop, obviously, to make certain that it's delivered consistently. Attestation can be very important, certainly the confirmation that they've reviewed the information, that they understand their responsibilities, that they have additional resources or that they can refer back to these resources, and that they may be asked to do additional training when requested. and then providing dedication of staff and maybe the education committee, if you come up with that, to answer questions, to provide clarity when needed, so having that as a resource. Again, with some of the programming in education, we recommend that you do training around this, certainly rehearsals and frequent reviews, so walking through facilities, understanding how people are going to meet the requirements that are put forward in your education. We already have mentioned that you need to make certain that all the different guidelines are met, and that if you have institutional programming that's going to be applied to student athletes, faculty, staff, that your content is consistent with your institutional programming and maintains the same language and consistency around what's going to be asked of everyone else on campus as well. So when we think about education, again, here's a checklist that what you'll have available to you about developing and then ensuring education for this group. And really, education and behavior modification, we know in this age group, is going to be the most important thing to preventing viral spread, as we've already mentioned, and will be something that all institutions will have to consider if they're not doing so already. I'm going to turn it back over to Haley for some legal considerations around education and training. Haley?
Thanks, Jim. So the first legal consideration is making sure that you identify within your training, is it mandatory? Do you have to take this training, and what happens? Because we all know that we have mandatory trainings, and then we have some stragglers that for whatever reason weren't available the day that the training was offered, and so we need to try to get them trained. And so determining that if it's mandatory, I think is really important. And then also, as Dr. Borcher said, explaining applicability to students, coaches, and staff, and whether or not the training needs to be completed before they return to sport. So, is this training going to be something that they all have to go through? And again, making it as easy as possible so that they could possibly complete the training via their smartphone or even, a tablet or something like that would be really important. I also think it's important to establish if there's consequences. Number one, for failing to follow the plan within the training. So not only just failing to do the training, but are there consequences if you fail to report and follow the institution's plan? So what do those look like for the student athletes? If there are consequences, what does that look like for the coaches or the staff? There probably should be some consequences if they fail to follow the institution's plan, and making sure that that's included within the training as well so that everyone knows, because whenever there's an issue legally, there's usually a couple things that happen. I wasn't trained, no one told me, and I didn't know that this was a possible consequence, even if it is somewhere in a plan or even if you've updated your policy. So make those determinations as to, do you have to participate in the consequence for not participating in the training, and then for failing to actually follow through on the plan. And the last thing I will say, and I'll explain this a little bit later under some tort theories if there isn't immunity for schools, is that you got to follow your plan. So do not allow the plan to be so robust and so, so much that you really can't implement it. That is the worst scenario. You can all think of things that we would love to do, like test our student athletes, 2 to 3 times a week, or, multiple times. If you cannot do that, do not include it and tell your institution that this is what you're going to do. If that is not something that is really truly available, that's just an aspiration versus something that you can truly implement. So make sure that you're following the plan. Do not overcommit. So Jim, I'm going to turn it back over to you to start on category 3, which is, I think I mentioned before, facility preparation and management. So I'll let you take it from here.
Thanks, Haley. I think in category 3 here, as Haley mentioned, we need to talk a lot amongst ourselves at our institutions about our facility preparation and management, and that includes medical facilities and our campus athletic facilities. But just as we have to have guidelines and policies around what we're doing with individuals, we're going to need to have guidelines and standards for our medical facilities and campus facilities that we're using to treat our athletes. It's going to be really important that we train our personnel appropriately for each facility as we return to participation of sport. And that doesn't just include medical personnel, our athletic training, physician staff, potentially other medical staff that might be working with your athletes, but it's our actual facility staff, our event management staff, our administration staff, to understand how the facilities are going to be used during each stage of return to activity and what each of those stages requires as we return to activity. So it's going to be important to identify, implement, and monitor safety measures at each facility around equipment, resources for proper hygiene, as we mentioned, certainly disinfectant and a sanitization plan for all of the equipment and areas that are being used by athletes. And as Haley mentioned earlier, access and entrance to facilities. So this is where training and rehearsal is really important. Having one entrance to the facility where it's monitored, for example, where symptoms and temperature checks occur, where people are masked, where they move consistently through the facility so that they don't come in contact with the area more than one time, and that there's a separate exit when they leave the facility. We talked about equipment maintenance, but it's really important that we have the ability for all the equipment and surfaces to be sanitized and disinfected after each use. And that makes sense certainly in the athletic training room with all their equipment and tables that might be used, but certainly thinking about that in the weight room and in various workout spaces. One of the things we want to make certain is not happening, that happens often in athletics, is shared personal equipment needs to be prohibited. So certainly water bottles are one of the first things that come to mind, and then any other shared equipment needs to be eliminated to prevent spread and also to promote good hygiene in this environment. We certainly want to identify high-risk hygiene areas and educate on the procedures for these areas, and again, utilizing closed containers for all disposable and reusable hygiene materials such as towels and such. And then providing adequate resources for hygiene, and that may be increasing hand sanitizer stations or identifying where people can wash their hands frequently with soap and water for 20 seconds to help with the plan. Certainly, those protocols need to be developed, but we want to provide that plan to be transparent so that everyone knows and is confident that that's occurring. And then, as I mentioned here, the access and entrance to facilities, we certainly want to close all our facilities to the general public and certainly know exactly who is entering and leaving those facilities. This is where defining an essential personnel is really important and being able to contact trace if an exposure occurs. We want to make certain that we have quarantine facilities for use when needed. What happens if an athlete does show up at the facility, or coach or staff, and they are symptomatic or they have a temperature? What happens at that point? Is there an area for them to be quarantined until further instructions? And certainly that area where that is, that isolated daily check area, is important to identify as well. I mentioned implementing and monitoring arrival and departures at each facility, as contact tracing will become important through these facilities, and also the supervision of those protocols for all training sites, making certain you know who is supervising that, and making certain that these things are happening on a daily basis. So again, a short checklist over category 3 for facility preparation and management, things that need to be in place and that we want to make certain are in place around all of our training facilities, medical facilities, and competition facilities. I'm going to turn it over to Haley here for some legal considerations around facility preparation and management. Haley?
Yes, so as I was talking about earlier, I just want to go over some possible tort theories and really point you to a NACUA note for those attorneys on the phone by James Keller. He did a great job. I've put that at the bottom of this slide because it's really helpful in thinking through preparation and management for facilities and legal considerations. So the first bullet is landowner liability. And basically the definition of this theory is that because the school owns the land and should know about the risk of COVID-19 harm to the invitees of the land, if the invitees fail to protect themselves and the school fails to exercise reasonable care to protect the invitees against the danger, then the school could be held liable. So a theory of liability, tort liability, those public schools that are on the call today, many of you have sovereign immunity laws within your state and cannot be sued for torts within your state, but this is something for private institutions and other institutions to be aware of, especially if you don't have sovereign immunity, to know that this is a theory of liability as you're inviting individuals to your campus. And remember that, I agree with Dr. Borchers. In terms of this back to sport, the more you can control the use of the facility through one entrance, one separate exit, and put in place your plan, your protocols when individuals are in that facility, the better off you're likely going to be. But the risk is still there, and that's what everyone needs to be aware of. The next definition of another tort theory is negligence per se. And this is if the state passes a law saying that every landowner must take specific actions to protect against the risk of viral transmission, and the school doesn't take those actions, then anyone harmed could argue that the school was responsible for a theory of negligence per se. Now, again, that assumes that there's some of this language within some of these state laws. And then finally, the last tort theory, the one that concerns me, and I brought it up already during this webinar, is the gratuitous undertaking. And this rule applies to institutions that take steps to mitigate the impact of COVID-19, but don't implement those steps properly. So people who contract COVID-19 on campus can argue that the school increased their risk of getting sick because they relied on those mitigating measures and they didn't follow their own measures, which resulted in harm. So be careful of those types of legal considerations. One other legal consideration that I want to just point out and put on your radar is that some institutions are retrofitting or adding additional protections, whether it be some sort of barrier, some sort of partition, plastic partition, or other types of PPE that they're providing to student athletes or hand sanitizer. And schools are actually able, some schools, so you want to talk with your attorneys, and we have an expert at Husch Blackwell, Tom Shorter, but are able to apply through FEMA for emergency grant relief for some of the money that it's costing institutions to become ready to have students back, and that includes return to sport. So if that's something that your institution hasn't thought of in terms of, whether or not you qualify under FEMA and whether that makes sense for some of the expenditures that you're having, that may be something you want to look into too as you look at all these legal considerations for opening back up your facilities. Dr. Borchers, I will turn it back to you to talk about return to campus recommendations, category 4.
Thanks, Haley. So we all know that the goal is to get a return to campus so that our athletes, coaches, staffs can begin to return to train and hopefully get back to sport. But we know that we need to have a commitment to change the culture of athletics if that's going to happen. This is a new and uncharted way to operate for most of our athletes and coaches, and so it's going to be really important to think about some of these fundamental concepts when we think about returning to campus and sport. Maybe most importantly is the implementation now of routine testing and or monitoring of student athletes, coaches, and staff. How do we mitigate risk, which is some of the things Haley's been talking about? How do we have compliance to social distancing, personal and group hygiene strategies? And then how do we make certain, as Haley mentioned, we actually follow our established isolation and quarantine procedures? So one of the things that we need to think about medically is the implementation of testing and monitoring. And I could not agree with Haley more when she mentioned that having an aspirational testing program is fine, but to put an unrealistic testing program out there and for what it would accomplish is actually more harmful than helpful. And so one of the things that we are recommending, and that is recommended with almost all health, local, state, and federal guidelines, is that there's a daily health check for athletes, coaches, staff, or anyone that's entering the building. You certainly want to make certain that we're updated and looking at the most appropriate symptoms for COVID, and there's certainly a number of them, but making certain that we're checking that daily, having a way to make certain that temperature is checked as you enter the building, and certainly that if there is an individual that has these symptoms or meets criteria for further evaluation, that you have a process to make certain that that happens. And then, as Haley mentioned as well, we want to make certain that our facility maintenance standards are maintained, especially when someone tests positive. So we want to make certain that we stop activities that are going on, not put people at undue risk of exposure, and make certain that proper disinfectant and sanitization happens of facilities. When we talk about risk mitigation from our standpoint, we think it's really important that you identify the role of essential personnel, and that's who absolutely has to be interacting with the athlete to contain the number of individuals that may be at risk for exposure. And so that containment could be done many ways. There's talking at some institutions of providing, for example, identification that identifies staff as being able to enter certain restricted areas, and other staff that may have been able to enter those areas in the past not being able to enter at this time. But thinking about how you're going to address those essential personnel is going to be really important as we think about our return to campus. As we've mentioned already, the compliance to social distancing, personal and group hygiene is going to be critical for the success of any program. Certainly maintaining at all times when you can that physical distancing, social distancing, and physical separation of athletes, coaches, and staff. We're recommending that you still make certain that you maintain the social distancing and the use of face masks when possible in public spaces and inside training room facilities, making certain that we're adhering to using distance learning and meetings when possible, when in the past teams may have been meeting in person, and certainly limiting, to most of your interactions to very small groups with a minimum of 6 feet between individuals. And just to, kind of emphasize the idea behind 6 feet between individuals is really best when a face mask is on. So really, if you're not going to be masked, you should have more space in between individuals to try to reduce viral spread. We certainly want to make certain that, as we've mentioned, we're following established isolation and quarantine procedures. There's nothing more devastating than not following these procedures or individuals making decisions to not follow these procedures, and then they exponentially expose a greater number of people to viral infection. And so certainly that's mandatory reporting of health changes, stay-at-home requirements. I cannot tell you how important it is for people that are sick or exhibit symptoms of COVID-19 to stay at home. They should not be coming in to the facility for further evaluation. There should be a process by which they're directed to receive appropriate care and testing if needed, and going through the appropriate diagnostic steps that are mentioned here, but not coming into the facility and certainly not practicing or putting others at risk for transmission. So again, just a brief checklist here of what we've discussed on your return to campus recommendations, and ensuring these components amongst your campus as you think about how you're going to return your athletes, coaches, and staff to campus for your athletic facilities. I'm going to turn it over to Haley here for, again, some legal considerations around return to campus recommendations. And Haley, all yours.
Thank you, Dr. Borchers. So I just wanted to go back over kind of things that you could do and return to campus if you're thinking about this assumption of the risk form or even a waiver. And again, if you think about waivers, they're very state specific, so make sure you have somebody within your state that is an attorney that is reviewing that and assisting you with it. But the how to increase your likelihood that these types of measures for return to sport would be enforceable are, number one, some of the principles that we've talked about today. Educate on the known and unknown risks associated with COVID-19, and make sure that you explain that the program is taking measures to lessen the transmission, but it's impossible to to say that you're going to prevent all transmission of COVID-19. require student athletes to acknowledge the voluntariness of this decision and the fact that they're electing to participate despite the risk. And we're going to talk about the other side of that too, as we continue on with the webinar. But make sure that that's part of the form that you have. And I would utilize things like bold and underline for these critical components that I have on this slide to make sure that people are aware. Because student athletes are used to signing forms. Let's be honest, they sign a lot of different forms when they return to campus or even at the beginning of their sport. And so make sure that you're being very clear and upfront, especially with some of this language, that they couldn't have just missed it in a two-page document. That it's very clear. And then require the student athlete to sign the form. And we even ask that you keep a copy as the institution, but that the student athlete will keep a copy as they should have access to it as well. And that on there's reporting information as to if they have symptoms or what they're supposed to do. Provide some easy one-page handout that provides information that goes with your plan as to what your expectations are. And then finally, and I know I've said it before, so I'm sorry, but I'm going to say it again, do what you say you're going to do. So if this is your plan, make sure you have the ability to implement your plan. And if you're going to require quarantining or however that's going to work at your particular campus, make sure that you follow what you've said you were going to do as you move forward. Dr. Borchers, I'm going to turn it back over to you for training and practice modifications, which is our Category 5 today.
Thanks, Haley. I think as most of us are returning our athletes to campus and are getting into training for sport and then thinking about practice, we know that modifications are going to occur, and there's going to be some general modifications and then sport-specific modifications. Certainly, we want to think about that, as we mentioned, with facilities risk evaluation, the sport-specific evaluation around training and practice modification, and then really want to emphasize individual acclimatization. One of the things that is really concerning about COVID is that appropriately today and at other times we're spending quite a bit of time talking about how to return our athletes to campus following COVID and how to prevent the spread of this infection and allow for participation in this time of a pandemic. But there are several other health issues that we need to consider around athletes, and we cannot forget those. Those do not go away, and our accountability to those do not go away, especially around our individuals and teams. And so we need to make certain that we're paying attention to those as we think about how we're integrating athletes during this time of COVID. As far as facility-specific recommendations, along with your athletics COVID-19 action team, practice and training facilities need to be evaluated to rate the level of risk at each training and practice facility. That could be along with your facilities management folks, looking, is this an indoor-outdoor facility? Does it have the capabilities to open to the outdoors? What's the population density in that facility? And then thinking about how you can maybe modify where things happen in certain facilities to decrease that risk of spread. Certainly, we want to think about travel and competition with teams in different geographic areas, and this is becoming more and more of a consideration as we get closer to potential travel and competitions. And I know that many leagues and institutions are thinking about how to limit that travel in certain geographic areas and make that travel possible during this time. We certainly want to reduce levels of risk as much as possible. As Haley said, there is no way we can completely eliminate risk. This is no different than concussion and contact sports. We do everything we can to minimize risk, but we cannot completely eliminate it. We want to make certain that we limit physical contact with others as much as we're able to. That may mean modifying certain practice techniques to doing only what's absolutely necessary during training to make certain that we're ready for sport, but trying to find other ways to train. We want to limit competitions with teams from different geographical areas when possible, and I know that many institutions are looking at ways to limit significant spread to various areas of the country when there might be alternatives to limit spread from those areas. And then certainly want to perform skill building drills or conditioning while practicing physical distancing and social distancing. And so we've encouraged many folks to review with their medical staff or others various drills that they might do and the potential risk to the athletes with those drills, and can they do something to modify that to reduce risk of spread. When we talk about sport-specific recommendations, certainly we want to balance risk about the areas of what we need to do to prepare for sport and what we need to do to prevent spread of this virus. And there's some sports, especially contact sports, football and soccer coming up in the fall, where the level of risk really can't be reduced much without changing long-established training and practice procedures. We know that there's going to be times of higher risk, but we need to make certain that coaches and staff reduce the risk as much as possible when able, and that the medical staff and others are part of those conversations to have a concerted, transparent effort around what is absolutely necessary and where can we make modifications. We need to think about individualized training and practice recommendations, and certainly we need to consider these for each athlete. It's very clear that we don't know what the activity levels for our athletes were while they've been quarantined for the last 3 to 4 months, and certainly many of our partners have been discussing with us that their athletes, although their best efforts, are coming back in worse shape and poorly conditioned given their situation around this pandemic. Certainly we want to think about that as we're getting athletes back into activity and extending transition periods if needed to make certain that athletes do not suffer from other health issues that can come with returning athletes to activity too quickly. We also want to think about the return to activity from illness, and if you do have a COVID positive athlete, and what that transition period will look like. And we also want to think about when athletes are returning from different geographical areas. We need to consider weather concerns and temperature differences as we talk about the risk of heat illness as we return athletes, but certainly if they've been sick, what their other issues may be as they return from different geographical areas. And as Haley has mentioned and we've mentioned, understanding travel, where they're traveling to, and what their potential risk may be if they're traveling to quote-unquote hotspot areas, and trying to prevent that travel as much as possible is going to help keep our athletes healthy and able to perform during these activities. So thinking about these areas, a checklist here as we think about training and practice modifications, facilities risk evaluations, sport-specific and individual acclimatization. Probably the most difficult thing here in Category 6 as we go on to finish up here today is sustaining cultural change. All of these things look good when you're sitting in a conference room and you're talking about them around a table and you're putting documents together, but it's actually sustaining cultural change and programming to ensure that this new normal remains that's going to be important. This doesn't go away after a week or two of being on campus, and so creating a return to campus roadmap is really a commitment to cultural change. And that has to incorporate our campus policies, certainly what we've talked about, local and state and health department policies and federal initiatives. But it's really going to require an unconditional buy-in from athletes, coaches, medical staff, and department staff in order to make certain that this cultural change takes place. If we have at the foundation of this that our ultimate goal is safe, uninterrupted participation in competition, then we have to understand that we have to sustain a cultural change in order to achieve that goal during this time. And I think we've all seen examples of what happens if we don't look at that cultural change, that there can be spread of this virus in an unnecessary fashion. So we know that change takes time and effort. We know it's difficult with ever-changing policies. And even with a vaccine or treatment, please understand this, even with vaccine or treatment, cultural change will take persistent and continued education. If we get a vaccination in 3 or 4 months, or if there was a good oral treatment for this virus, it will not change the fact that we'll need cultural change to participate in a safe fashion for sport. And we need to make certain that we have support from the highest ends of leadership and administration to affect cultural change at all of our institutions in order to make this happen. So again, sustaining cultural change is not easy, but we felt like it was really important to mention and how we create cultural change and looking at continued evaluation around these areas, continued partnering, collaboration to make certain that your institution is doing everything it can to make certain that your athletes, coaches, staff, and others are staying safe during this time. And I'm going to turn it over to Haley one last time here to talk about some of the legal considerations when we think about sustaining cultural change. Haley?
Thanks, Dr. Borchers. And again, this kind of goes along with our theme, but I just wanted to point out to you that the NCAA did a student-athlete COVID-19 well-being study that had a lot of information in it. But essentially, I've taken some highlights from the study that a majority of the participants, this was done in the spring, experienced a high level of mental distress, and even 1/3 of the participants in the study said they had experienced difficulty sleeping due to the emotional distress due to COVID-19. 90% of them say that they really rely on the support of their teammates. And in looking at where they're going to get information, the student athletes said that they would look to their coaches as the primary source for assistance, and then secondary tier within athletics. So really understand that a lot of our student athletes are struggling with this, and as you look at those issues of assumption of the risk policies or forms or other types of forms, and you're saying that you are voluntarily agreeing to assume this risk and that you understand what the risks could be, which are, can be quite severe, that you may have student athletes that are saying that they would like to have an assessment under a possible disability for mental or emotional distress. And I think that's important as you look at an ADA or Section 504 considerations for individualized assessment. And so remember that it has to be individualized, but is the student ill with COVID-19 or have they been exposed? Does the person have a physical health condition that could create an increased risk for that individual? Is the person experiencing anxiety or another mental health condition that could require an accommodation? And, is it possible that you may see some of your students, because of what they're dealing with, that may request medical hardship waivers? And what is that going to look like if that happens? We anticipate as we go back into the fall, the numbers of just the general student population increasing of asking for support through our ADA, which applies to our public schools, and in terms of student accommodations, and Section 504, which applies to our private schools. So don't forget that, and know that that could be the same for a student athlete that is dealing with the emotional stress of COVID-19. So, Dr. Borchers, we have time for a few questions. We did do a lot of talking, so we don't have a ton of time. But let me just ask you a couple of questions that have come in during this time. The first one is there a true benefit to have social distancing measures before and after competition when there cannot be social distancing during competition? What do you think about that question?
Yeah, so thanks, Haley. So the answer to that question is yes. And the reason is that prevent viral spread, it's most important away probably from our competition sites. So if we are doing a really good job of preventing spread outside of the athletics environment, that is really going to help prevent spread inside the athletics environment. So we know for many sports, the actual contact for our outdoor fall sports, for example, in football is about 6 to 7 seconds. Even in soccer, the actual contact when you're with a person is measured in matters of seconds. And so making certain that we're adhering to wearing face masks in common areas, social distancing outside of sport can be really important to preventing spread inside of sport, even when we're not using vigorous testing protocols.
Thank you. We have quite a few questions. The next one, Dr. Borchers, what are your thoughts about testing student athletes during quarantine to shorten the 14-day period?
I think you need to be really careful if you're thinking about that, because there is not necessarily a great strategy to do that. Many have tried to talk about that. But unless you're going to vigorously test during that quarantine period, which may be not possible for most institutions, it's really difficult to make that decision on how often, to when you would test, and then how often to allow somebody to exit quarantine early. And so whether or not you're going to test every 48 hours or every day, look for 2 negative tests, look for the resolution of symptoms for 72 hours. I think that there is, there's just a reality factor around that. And when you start to cut corners in that area is when you can get yourself in trouble. So I would just make certain you consult with medical officials that have expertise in areas around public health and infectious disease before you make a decision to shorten quarantine times independently.
Dr. Borchers, the next question is, do you suggest daily temperature checks, or it says that their plan has temperature checks as needed? Is that okay?
Well, the reason that I would recommend that you have daily temperature checks is because it holds people accountable to reporting their symptoms daily and gives them a cadence or a routine to make certain that they're thinking about that. And we hope that through these routines and this cadence of routine, you're, affecting behavior. And so, my recommendation would be is just with most healthcare facilities, we should be just as vigorous with our athletic facilities, and checking your temperature once a day, making certain you review your symptoms once a day is really not too onerous, and we hope will affect behavioral change that will limit the spread of this infection when we don't have good treatment or vaccination. So I do think, if possible, taking a temperature along with daily symptoms is a good way to monitor and affect behavioral change.
Okay, and then we have time for 2 more, so I'm going to ask this first one. The first one asks, do you have any advice or considerations if you're hosting a game at your campus and what that would look like in the fall? And we didn't talk as much about that, but that may be a follow-up webinar to this, since there's so many questions. But what do you think about that, Dr. Borchers?
Well, I think the question around hosting events is going to be, what is the requirement going to be for those essential people that are traveling to your campus to have that event? So that would be the essential personnel and athletes from the other team. What are the requirements that you're going to agree upon for testing, or the criteria needed to hold the event and participate in the event safely? And then considering the event management around what else happens around that event and who would attend that event, whether or not you would have fans at that event, what other personnel would be at the event. So I think those are the things that need to be discussed. And you're right, Haley, that's probably a discussion that requires almost a whole nother webinar. But I think that's one of the things that many people are struggling with, is how to come up with that consistent criteria in order to hold those events, and something that needs to be considered before doing so this fall.
Okay. And last one for today, and thank you. We have more than we can answer right now, but we're already over time. Can you talk about the number of student athletes that should be allowed to participate in a particular practice? And then the comment was that this individual has heard that 10 was the limit, but for soccer and field hockey, could you have 10 on each half of the field? Or, volleyball, yes. I guess, could you split the volleyball court?
Yeah. Yep. So I think that, again, the recommendation is that you train in small groups as much as possible. And certainly 10 has been a number that has been used very often to try to limit the number of people that come in contact with each other, mostly for contact tracing, so that if you have a positive, you can identify that small group of individuals and not be putting a large group of individuals at risk for viral spread. We know that during sport, training in these small groups is sometimes not going to be useful when you have to have full team activity. For example, performing set pieces in soccer or set pieces in field hockey, or if you have, in football, eventually you're going to have 11-on-11 activity in order to practice football. But what we're recommending is that you look at your practice plans and certainly think about how you can limit those numbers of interactions, so that you can limit the number of individuals as well that might be exposed if an infection were to occur. One of the things that mitigates this is how vigorous you're going to test, because if you're testing frequently, you can have more certainty that you have negative individuals. And if you're in somewhat of an enclosed environment where that essential staff and personnel has been limited, you should have some, improved idea around the fact that you can have more people participating with less risk of infection, but that's going to be different for each institution. So certainly trying to maintain those small groups is optimal, but as you mentioned, using multiple fields, splitting the practice court, doing things like that to limit exposure is still recommended as we return to sport.
Well, thank you, Dr. Borchers. I know we've gone over time, but your information, you're a true expert, and being able to rely on you and be able to ask these questions is a phenomenal benefit for, I know, myself and everybody on the phone. So that's the conclusion of our webinar. If you have not already done so, if you'd click on the survey icon at the bottom of your screen to complete a short survey, your feedback will assist Husch Blackwell in providing quality future programs. As a reminder, this program has been approved for Illinois, Iowa, Nebraska, and Tennessee continuing legal education. It is currently pending in Missouri, Texas, and Wisconsin. A recording of this webinar will be available tomorrow for watching and sharing. Once available, you'll get a link emailed to you, and you'll have 2 weeks to be able to view the webinar. Please join us for our next webinar on June 30th that will center on COVID-19 driven trademark and copyright issues in higher education. This completes our webinar. Thank you so much for your participation.